well,
Oh.
where I teach about mental health, and also about I teach psychiatrists worldwide.
Wow. So I would go straight to my questions, as we have celebrated the Mental Health Week, and as I spoke to you earlier, when we say mental ill health, what are we talking about?
Yes, well, I think when mental ill health is, when people are talking about mental ill health, we know that, it's like a physical health problem. When people have diabetes, for example, that's a really good question, because, we all know when someone's got diabetes or someone got high blood pressure, for example, hypertension. So we know that we talk about mental illness in the same context, because physical health is a physical health problem, but mental health has to deal with mental health problems.
Yeah.
So it means that someone might have a mental illness. So in terms of, they might be depressed, they might have schizophrenia, bipolar affective disorder. They could have other forms of ill mental health. So when we look at mental health, we're thinking about someone who has some form of illness, and as a result of that, it's called, we're looking at someone's mental health.
Yeah. Thank you very much. So what happens to the person's mind, like if the person is diagnosed of mental health illness? What is actually going on? Is the person out of touch?
Well, yes, I think a person loses touch with reality, and a person, it can be different reasons. For example, when someone is depressed, they might, because they are feeling depressed, and they have symptoms of depression, and so that could be depression. Someone's got an illness. And then we look at other forms of illness as well, where people might have bipolar affective disorder, where they, have two poles to their illness. They have a high and so they might be manic, or they might be depressed as well. So there's different ways in which someone can present with mental illness.
Wow. So people presenting mental illness in a different way. In your own opinion, what group of people have you noticed that you would see mental health in them? What group of, when I talk about what group of people, I mean ethnicity-wise, what is the prevalence of mental health when it comes to ethnic groups?
Yes, well, I think that's an interesting question. So there are lots of studies being done on mental health and the different groups as well. And so in terms of the prevalence in ethnic minority groups, we still see a high number of mental health illness. So we do see that there are people in different of in these areas and in these groups that do present with mental health problems. So there is it. So what I'm trying to say is that from the studies that we have available, we know that people do present with mental health problems, and so it is quite common in terms of presenting with mental illness.
Thank you very much. So I have a personal question about this. Does mental health comes with family upbringing? Like, say I have a mental illness. Let's assume I have a mental illness. Can that associate it to my upbringing? Like, people will say that because you weren't brought up properly, so you had mental health, or because your father wasn't present, so you grew up having challenges with your mental health. Is that so?
Well, there can be different reasons why someone presents with a mental health problem. So it could be that, I mean, in terms of obviously the example that you've given, yes, it can be. If someone obviously has a difficult upbringing, it could be that then impacts on them and affects them in the way, as you've just said, where the person might present with some mental health problems. So, for example, if they grew up in a single parent household where they obviously didn't have a father, or whether they had history, there's a family history of someone with mental health problems. So all these factors, so we know that, I mean, what you've asked is really interesting because we talk about the environment and the gene. So we know that a person genetically can be linked or can be more vulnerable to develop some mental health problems. And so there's certain conditions that are higher in certain ethnic groups. So we know that sometimes if people, for example, with schizophrenia, people with lower socioeconomic and Afro-Caribbean could be at a higher risk of developing these conditions. And then we know as a result, as you were just saying about the environment, if something has happened. So we know that the interaction between a gene, so a person's genetic component, and the environment and their upbringing can also impact on them and affect them in a way that they can develop and have mental illness. So it's really important what you've just highlighted, because environment can place a lot of stress on a person. As you know, for example, if someone's growing up in a childhood or environment where they are faced with a lot of challenges, and if they don't have enough coping skills or they're not able to cope with the day-to-day stresses, it can affect them in the long run, where they can then develop some mental health conditions. Or they might, for example, you know, as you said, if you're in a environment, for example, if you are in an environment where you are watching someone being abused or someone being assaulted or growing around violence, you know, which is sometimes happens in some communities and some families. And as a result of that, you can experience PTSD, which is post-traumatic stress disorder. Oh, wow. So there's so many different conditions in which people can still present with obviously mental health problems. And what I want to say is, you know, you were asking about the different conditions and especially in minority, in ethnic minority groups, and specifically we're looking at Afro-Caribbean. I think we do see that from the research that's been done, there's a lot of studies, for example, with schizophrenia. They've done studies on Camberwell studies. We've got other studies, you know, specifically looking at depression and bipolar and looking at substance misuse, PTSD. So I would say in the Afro-Caribbean population, you can get all the conditions that you can get in other populations, you can get as well in the ethnic minority groups. And I would say that people in these groups are definitely, you know, myself included, coming from a BAME community, we are definitely at a higher risk of developing these conditions.
Wow. So, doctor, let's assume I am one of the people with challenging mental health. What are the prospects for me? What can I do? Hello, doctor. Hello. Okay, I think doctor is out at the moment.
Because we're giving... Because we are now able to have a chance to talk about mental health problems and normalize it and say, you know, there is such a thing called mental health, and that if people do have any symptoms of mental health problems, for example, like depression or bipolar or schizophrenia, then a person should try and get help. And I think that's one of the things, is trying to get help, because we know that if someone is going through a difficult time, I mean, the question was, how does someone get help? And there is a lot of help out there. Surprisingly, Patrick, there is help, but people are not willing to get help. So it's more to do with that, the fact that people are scared to talk about. I mean, I don't know about how it is in your community, but certainly in our communities, I know it's really difficult to talk about mental health. It's difficult to talk about how you're feeling. So there is an issue with mental health. But getting help is really important. If you are suffering with a mental health problem, or someone that's got symptoms and signs of a mental illness, for example, someone with depression, someone with bipolar or schizophrenia, someone that's self-harming, or even medicating themselves with drugs and alcohol, then we need to think about getting help. And I think the first step is asking for help or signposting that person to help. You can contact your GP, your general practitioner, the nurse practitioner, and then we have specialist services like the psychiatric teams. So every town, for example, Bedford, where you are based, we mental health team, and we'd have a community mental health team and different other teams, specialist services, and we'd have services for children, for older adults, people with psychosis, people with learning disabilities, forensics, eating disorders, and then we'd have other services, the inpatient services and crisis teams, which will work 24/7. So if someone is experiencing a crisis where they're self-harming, they're not able to cope, then we'd have the crisis team that can support them. And obviously, all the treatment that is available, we usually talk about treatment in holistic terms, Patrick. I don't know your understanding. Do you want me to explain a bit more about what that means?
Yeah, please, if you can explain a bit more for me, I'll be very grateful.
Yes. So, I mean, holistic. So holistic is, we talk about medication or the biological treatments or interventions. I'll talk about each one separately. Psychology is the psychological interventions or therapy, and then the social aspects, which is the social interventions or therapy. So biological means, and medication is, as you know, for every condition that we have, we use a combination of these three therapies and alternative therapies. And this is what's recommended by the guidance that we follow. So as doctors and psychiatrists, we follow the NICE guidance, which is the National Institute of Clinical Excellence. So for example, if we something like depression, we know that a combination of medication together with psychology or talking therapies like CBT, cognitive behavioral therapy, we know that these two combined together has been found to be very effective. So for someone that's going through a low mood, they're depressed for more than 2 weeks, they can't concentrate, they're not motivated, they're having some negative dark thoughts, and they might be suicidal, this is one of the forms of treatment that we could provide them with. So it's a holistic approach. We look at medication, which are called antidepressants. So the medication, because it's called an antidepressant, it tries to increase the happy chemical in our brain. So serotonin is released when we exercise. So if you go to the gym or if you exercise regularly, you know that serotonin is a happy chemical that's released. And this is what happens with the medication. The medication tries to increase the level of serotonin, which is low in the brain when someone is depressed. So a lot of the time, the cause, we were talking about the causes of mental health problems. It could be stresses, it could be genetic, it could be related to, like what I'm saying, a hormonal or chemical imbalance in the brain. So there's different reasons why we have mental illness, and then it's about treating the specific cause. So as I was saying, in depression, we use a combination of medication, we do psychology. CBT, I don't know if you've heard about it, but has been shown to be very effective. I we've learned about CBT, and I've also done CBT with patients, and
Okay.
it has helped, because what happens with CBT is they try to identify, so it's cognitive behavioral therapy. So it means cognitive is our thoughts, behavior is how we behave in relation to the thoughts that we're thinking. And the therapy means that you do one-to-one sessions with a trained therapist, regular. It can be anything from 12 to 16 sessions, but at least 50 minutes. And in those sessions, the person will learn to change the way they're thinking from more negative to a more positive. And eventually, all those symptoms of depression, when they change their thinking from negative to positive, and they change the behaviors related to their thinking, then as a result of that, they will start having a more positive outlook on life. They'll start feeling a lot happier, and all the symptoms of depression slowly improved. So cognitive therapy is something I can say, without a shadow of doubt, is very, very beneficial. So especially, Patrick, not everyone wants to take medication, and we understand that.
Yeah.
We have young children that are going through, stresses at school, or personal difficulties and challenges. We haven't even touched on the surface about how young people in the minority group feel about growing up, in context of the challenges of race. We haven't even touched on that, because that in itself can also cause some mental health problems, especially if a young child becomes a target of being bullied because of their race. This in itself can then lend to a child becoming depressed, or having sleep disturbance, or start coping with substances, or might affect their school performance. So there could be so many different reasons. But in general terms, as I was saying, treatment is holistic. So it's medication, it's psychology, and it's looking at the social aspects. So the social aspects, we look at support groups. So for every type of illness, we've got different support groups, and there's different charity organizations. For example, Mind is a mental health charity, and this charity, I can say I've heard really great things from people who've used them, people who've had mental illness. They also run support groups. They run different therapy groups. So in terms of support, we're looking at support in the family, educating the families. If we educate families about mental health problems, or friends and colleagues, then it makes it easier, isn't it? If someone knows what you're going through, wouldn't you agree, Patrick? Like if someone knows, okay, so-and-so is suffering from depression, this is how we treat it, and this is how you can help them. So in terms of social support, it's looking at educating people, educating the person about their mental illness, about the triggers, how they can help themselves, looking at charity groups, charity organizations that can help. And for example, the other things is looking at 12-step programs. So if a person is going through, substance misuse, if they're taking drugs, or they depend on alcohol, we know we've got groups like the 12-step program for Alcoholics Anonymous or Narcotics Anonymous. So as I was saying, there's a lot of different treatments available. If anyone's interested, you can always have a look at the Royal College of Psychiatrists. They have a lot of user-friendly leaflets on the different type of mental illness, which I've mentioned, like depression, bipolar affective disorder, OCD, panic disorder, anxiety, grief. So it's www.rcpsych.ac.uk. But other organizations like Mind, Cruise is for bereavement. During the pandemic, we've seen a lot of people go through bereavement. So that's something that's obviously affected all communities. So it's not just restricted to the BAME or the Afro-Caribbean communities, but it's obviously affected everyone. And that in itself has had obviously an impact on a person's mental health, as well. COVID, we haven't even spoken about the impact of COVID, the effect it's had on people, the quarantine, being in isolation, how it's affected people in terms of getting COVID and then having long COVID, and the of PTSD, and people losing their jobs, losing loved ones because of COVID. So it's obviously affected all communities, but I would say, I think the difficulty, as I said, going back to what I said, is because in our communities that we're talking about, and especially in maybe in the BAME and the Afro-Caribbean communities, we're not used to talking about our feelings. And especially, I don't know about being a male. It's something about being male, being macho. I was walking past a sign today, the Samaritans, and it said, it's okay not to be okay. And that's what we try to promote. But unfortunately, society dictates and our communities dictate that it's taboo to talk about how you feel. I don't know whether you'd feel comfortable just going up to your mate and saying, you know what, I'm not feeling well. It's very hard, isn't it?
Yeah, it is. It is. It is. So, the segregation that comes with it.
Yes.
So at the end of the day.
This is what we're dealing with, and I mean, you being a male, I'm sure you can understand what I'm trying to say. It's hard, even in your families to talk about it. Say if you go to a relative and say, you know what, I'm going through a very, very difficult time. How many of them will say, okay, tell me about it? They'll just say, you know what, you just get on with it. You just need
you need to be a man, you see.
Exactly. So what do you do then? I mean, if you're struggling.
Very true. Very true.
Yeah. So I think what it's about is, that's why it's so important that we spoke about this today, because it's about us normalizing mental health problems, making people aware that there is such a thing as mental health problems, that if so-and-so, if you can see, maybe Tom or Jess is starting to isolate themselves, or they're not going to school, or they're bunking work, they're starting to show signs that maybe they're drinking more, that, we need to start having these conversations and talking to people and listening. So I think the key skills is talking and listening and asking for help.
Yeah. Ladies and gentlemen, this is Patmok Radio UK. My name is Patrick, and this is the live train. This evening, we are talking about mental health, and we are having a conversation with Dr. Seshni, a consultant psychiatrist. She is opening my eyes to so many things. If you have any questions, you can text me direct message, or on WhatsApp, you can send it to 0741 302 5596. If you have any questions, let me know. I would ask the doctor for you. Dr. Seshni, going forward, I've come to realize something in the diaspora, that most of us see mental health illness as spiritual. And sometimes when we discover these things, we take it to religious houses for prayer to cast it out, magically disappear. How true is that? Is that ideology about mental ill health?
Well, that is so interesting that you brought it up, because I personally do feel that spirituality, so there's two things here. One is, I want to say that, yes, in terms of some communities, some people have this belief, the cultural beliefs, that it could be a spiritual manifestation, and that's why the person is not well. And obviously, go to churches or, different seek, like growing up in South Africa, they seek the help of the Sangoma, or in the Muslim, they seek the help of the Mulana. They might think the person's being possessed. So there's different cultural, obviously, beliefs, so that's one thing. And then the second thing is to talk about how spirituality can actually help when someone's going through mental health problems. So which one do you want me to talk about first? The first one that we were discussing.
Yeah, I want us to talk about how we think is spiritual and we attack solving it with spirituality. Then we'll come to how spirituality can help it.
Yeah, exactly. So I think what happens there's obviously a lot of beliefs around spirituality and how it can impact on a person's mental health. So they obviously, some communities, some religions, they do believe that when someone is unwell, it could be that they're either possessed, as I said, or that it's some effect of a genie or a curse, and that they have to do some sort of exorcism, or they might need to do certain rituals or prayers by a mulana, a priest, or different organizations obviously have different ways of dealing with it. And I think it's difficult because I think there's been a lot of research into this. And as I said, growing up in South Africa, there's something called a Sangoma, where people will actually go to the Sangoma and say, pay them so much of money and say, please help my relative or my child, this is what's happening. And I think it's hard to say that because it's a belief and it's a cultural belief. It's hard, doesn't exist.
Wow.
Yeah, that is not a reason why the person is presenting. Obviously, for us as psychiatrists and doctors, we know that people obviously present with mental health problems because there's a reason why, whether it's a genetic component, whether it's related to a stressor, a social stressor or trigger, or whether it's related to something that like a chemical imbalance, like the serotonin, and that's why the person's depressed. Us as a medical professionals, we have a reason, a scientific basis for why the person is behaving in that way. But I must say that obviously there is we have to be open-minded to think that if people have these beliefs, we're dealing with culture, we're dealing with religion, and we're dealing with people's lives as well. So we must understand each person's journey. And I think if we have to support families in that, and I think that is what has come out. Even with the Royal College of Psychiatrists, they have a specific group dealing with the transcultural and the different cultural groups and how that impacts on to the multicultural faiths and how that impacts on their mental illness. So I don't know whether that's the answer that you wanted, but what I'm saying is it is there. It's evident that people believe in it and we have to support people in it. So we cannot dismiss it. We cannot dismiss it when someone says, oh, this person is possessed, or, these are the beliefs that people have. But it's not about forcing the beliefs. It's about supporting them in terms of their and supporting them in terms of that person's mental health problems. So I think it is important. And just to say, I do practice something called Sukhiya Mahikari.
Okay.
And one day, if you want to get someone from that center to come and talk to you, but it's called the Art of True Light, and they're based in Croydon. They're based all around the world. It's a Japanese tradition, and basically it's about radiating light and giving people light. And what they say is that it's about purifying people's souls. So they don't talk specifically about mental health, but they talk about how we need to purify our souls with light. So, whether it's purifying with light or prayer or, different aspects, with this practice, they purify it with light. And they say the more and more we purify our souls, the more and more we help people for spiritual purification. So it's another way of looking at it. So, Sukhiya Mahikari, if anyone's interested, they can have a look at the online resources or the website. But going to the second part of what we were talking about spirituality, is that I actually at work, I presented a case a week ago about how spirituality actually impacted on the well-being and recovery of a person. And, it's saying because of confidentiality, I cannot disclose the details of the case. But what I've noticed and seen in my practice is that the more and more, when we use spirituality, so apart from helping people recover from mental health problems, when we look at spirituality, and that's why I was so amazed that you brought it up. I didn't even expect you to talk about this, but isn't that amazing how you asked the question? But the more and more we bring a person's spirituality in it, when people are going through difficult times, they find it hard to cope with. And sometimes when they have spirituality to draw their support, and if they draw strength from, it can help. And there's a lot of studies that have been done by people where they've actually, incorporated spirituality, and they've done, studies, where they've identified and they've seen how just by incorporating, the practice of supporting someone with their spirituality, whether it's they're Christian or Muslim or Hindu, Sikh, Buddhist, whatever faith you belong to, that, just supporting them with their spirituality, how that has actually impacted and helped them during their recovery and well-being. So I must say that it is really important. It's something I personally strongly feel about, and I do always try, even with my patients, to always have those conversations. And especially if we know someone is maybe a Christian or they, a Buddhist or whatever spirit, faith they belong to, I think it's important that we support people, because it's going to become more and more important as we progress. With the COVID and the pandemic, we've realized how important spirituality is. So I don't know if that's the answer that you wanted. Was there anything specific you wanted to know about spirituality and, specifically in the BAME communities or the ethnic minorities or Afro-Caribbean communities, spirituality forms a really important part. And I'm sure people that are listening will agree that, when they're going through challenges, when they're going through difficulties, that prayer helps. I've seen personally, prayer, miracles, going to the church, all of that just helps a lot. And I don't know what your thoughts are on that.
Yeah. Maudlin, you said you've worked with mind before, and then you agree with Dr. Seshni, but you are saying that spirituality helps other parts, say our spiritual being, but our minds remains untreated. So you personally don't pray when you feel depressed. You speak to a therapist. Not that you don't believe that God won't comfort you, but how do you train your mind to deal with it? So I think what you are trying to say is that you treat spirituality as spirituality, and when you feel depressed, you speak to a therapist. That is what you're trying to say. Thank you. So, Nana Adjoa Onyameba, you are also asking that do you think mental health patients are treated less favorable when they visit hospital? Dr. Seshni, is there anything like, say, a mental ill health patient will visit a hospital and they'll be treated differently from any other person?
Well, I mean, I as a professional, I would say no. We treat all patients with the same respect, compassion, and understanding as we would with any person. But I'm sure that people with mental health problems might feel more sensitive, that they are not being treated in the same way. And it's probably because of the difficulty and the situation that they might be in. It's probably the, if they're going to hospital and they're in a crisis situation, that in itself is such a stressful situation. And if you go and present yourself to A&E or present yourself to professionals, then you might feel, if you're not seen immediately, I think a person might feel, the person or their families or friends, whoever they're with, might feel quite sensitive that they are not getting the right treatment. But I think an answer to that is that no, we would not treat anyone differently. Any person that goes to A&E or hospitals or picks up the phone to a helpline number will be treated the same way as any other person. And just because you've got a mental health illness or mental disorder, you are not going to be discriminated against. So definitely no such thing. And I hope this encourages people to actually present themselves if they are struggling, or to ask for help or call the helpline numbers, because that shouldn't prevent them from seeking the help. it's so important, I must say. I really, I feel so passionate about mental health. I feel so passionate about people going through difficulties and actually asking for help. And I think the moment we can do that, and we can normalize mental health, we can reduce the stigma, we can make it okay, that it's okay not to be okay, then I think this is where we are going to break down those barriers, and also the misunderstandings and misperceptions. And one of them we've just spoken about, because that shouldn't, Patrick, that shouldn't stop someone from going and getting help just because they think, oh, I'm going to go to the hospital, they're not going to even treat me right. I'm going to be treated like an outcast, or I'm going to be treated, in so and so way. But that shouldn't be happening in today's day and age. We are really open-minded, health professionals. We work in a team. I'm just a doctor. We've got nurses, really brilliant, trained nurses. We've got social workers. We've got trained therapists, psychologists, occupational therapists, physiotherapists, speech and language therapists, you name it. We've got so many different professionals that work in a team, healthcare assistants. So there's different professionals, and all of us treat people with utmost respect, because we know, when someone comes with a mental health problem, you need to treat with them. They're going through such a challenging time, and the last thing you need is someone treating you different or ill-treating you. So we would always, and I want to emphasize, we'd always treat someone with respect, and with compassion and understanding, and not just them, but also their families, or whoever they come with, their relatives.
Thank you very much, Doctor. My time is really going. I would ask you this question as we will bring our conversation to an end, and I think we would call you again so that we visit these topics.
Yes, I enjoyed this talk. I do apologize if I was still sort of, just in the beginning. But I absolutely love talking about mental health, and I think it's so important. And I mean, you doing this, talking about it, and people that are listening, sending in some comments, and that's brilliant. I really liked that, before you ask your question, what the person Mulin said, because when you about spirituality is how people compartmentalize treatment and sort of different specialists. So the person said that, I really love that, that you go to a therapist and you'll talk about your problem, and then you'll go to the church and then you'll offer prayers. But this is what we're talking about. It's about combining all those treatments. It's combining all the different approaches in your life, because one thing might work for one person, medication might work for one person, another person, it might be the talking treatments, another person, it might just be, it might be all of them, the medication, the talking treatments, and, talking to someone at the church and someone praying for them. So this is where we need to be more creative, we need to be open-minded, and we need to use a more integrative approach. So it's holistic, but it's integrative, and it's looking at alternative therapies.
Thank you. So, Dr. Seshni, what advice would you give to people with mental health? Like, I know you've mentioned that they should seek help, but people thinking about the segregation, how people will see them, what advice would you give to them?
Yes, so I mean, that's a fantastic question, because it's World Mental Health Week. We had World Mental Health Day on the 10th, and the World Health Organization they are promoting reducing the stigma, the social stigma around mental illness. And we need to, like Oprah talks about it with Prince Harry, they were doing talks on regarding mental health, and it's about reducing the stigma. It's about also normalizing it. So if someone has to approach someone about their problems, that the person on the receiving end, or the person that's listening, will be able to respond in a more helpful way. So I think this is what it's about. If someone is going through any difficult time, they need to understand and realize that they can go and ask for help. They need to choose someone who's a confidant, someone who they can trust, and if they don't have a family member or colleague or relative, then they can seek help from outside. So that's where us as professionals and people working in mental health come in. And also these charity organizations like Mind, children's.org, Cruise, AA, Narcotics Anonymous, all these different groups, ad addiction. So all these different groups, that's where we come in, is where if someone is going through a difficult time, if you're feeling sensitive, or you're feeling, some people might feel, they feel so embarrassed, or they might feel that, that stigma is overwhelming, that they can't actually speak to anyone in their family. But so they might contact outside help. And I think I would promote that, if you can't find it in yourself, you're feeling so conscious and you're feeling helpless, I would say contact someone outside. So whether it's your general practitioner, a nurse practitioner, someone from a mental health team or the crisis team, or one of these organizations, I think ask for help. And I think people that are listening, that are on the receiving end of being able to offer advice and help, I think we all need to educate ourselves to become more aware. So, we might, it might be someone that we've noticed at work, or someone at school, or someone in the business area somewhere. We might notice, okay, so-and-so is not looking how they look like they're not taking care of themselves. They're coming to work late. They're canceling appointments, or, they're avoiding social contact, or, on social media, they're doing certain things. Then these are things that we need to pick up, and we need to then maybe think about approaching that person and saying, are you okay? So it's okay not to be okay. We need to normalize it. We need to make it okay for people to be approached, and also to offer help as well. So I think those are the main things. So it's every little bit helps. So it's not just about thinking that person is on their own, because we shouldn't. We shouldn't, in the way things are. And I do feel strongly that it's not just professionals that are responsible for helping people. I think it's communities as large. Everyone has a responsibility to help other people. Identify if someone is struggling. If someone is struggling, who's going to turn someone that's going through a difficult time? I think what the pandemic has taught us, Patrick, is that people are more compassionate. We've all had time to think and put the reset button and pause. And I think people have become a lot kinder, a lot compassionate, showing more understanding and compassion. So I think this is what a person that's going through any difficulties needs to realize, that if they are struggling, if they need help, that there is help out there, and they need to be the ones to be able to take that step. Or if they can't do it, someone around them needs to have that understanding and be able to say, okay, I think you're going through a difficult time. Let's try and make an appointment, or let's look at some organizations or services that can help you. And I think, the aim with this is, we know that people end up killing themselves with mental health problems. So whether it's harming by just, self-infliction, by cutting themselves, by taking overdoses, by, using substances like heroin or cannabis or cocaine, or drinking and becoming, dependent on alcohol, or whether they hang themselves. We know that people do end up killing themselves because of mental illness. And this is why this talk today is so important, is because it's for people to realize that it doesn't have to go that far. You don't have to be at that point for you to get help. So, yeah.
Thank you very much, Dr. Seshni. Yeah.
Yeah.
Yeah,
so
sorry, you're going to say.
Yes, and that's what I want to say, just for the closing point, is that I've treated so many people with mental health problems, and not just myself. All the health professionals around, the country and the world treat people with mental health problems. And when someone's going through it, things can look very dark and gloomy. But when you're going through it, it's hard to see any light at the end of the tunnel. But I can say that we have had success rates with a lot of people. And that is why we treat people holistically with medication, psychology, social, and a range of alternative therapies, because people do get better. It's, like built in a day. It's all about taking those baby steps towards recovery and well-being. And eventually people do get better. So it's about giving each person that hope that they will be able to recover. And people do get better. It's all a journey. It's all a process. It's about, they say happiness is a journey. It's the same thing. It's a process. It's a journey. We all have to take time to heal. And when you go through difficult times, when you experience mental health problems, it's not like it's, where you cut yourself and you can just put a Band-Aid over it. And you know that you've cut yourself because you can see it. Or if you've broken your leg, if you've injured if you've broken one of the bones and they've put a cast and, 6 weeks time, it's going to be healed. It's not like that. Mental health, you cannot see with the naked eye. It's not visible with the naked eye. So it's about thinking that, someone could be struggling. They could be really internally going through so much of turmoil and conflict and difficulties and crises. And then it's about helping them to heal and helping them to recover, giving them that hope that things will get better. And eventually tomorrow will be a better day, and this too will pass. And the sun will shine, after the clouds and the rain and the storms, that sun will shine and people will start to feel a lot better and, believe that, that tomorrow will be a better day. So, yeah, I think that's a good note to end off on.
The sun will shine. Tomorrow will be a good day. Thank you very much, Dr. Seshni. I am really, really grateful. Like, I know I gave you a very short notice, but you responded. I am so grateful. Thank you very much. Thank you so much.
Thank you, Patrick. It's been absolute pleasure. I absolutely loved it. And I hope I'm going to chat to you again and your listeners are going to send us more questions and we can help them through whatever difficulties they are going through.
Sure, we will. We will. Thank you very much, Doctor.
Thank you so much. Have a fantastic
day. You too.
Thank you for listening. Bye.
Bye. Doctor, thank you.
No,
thank
you're
you
welcome.
So much.
I hope that was okay.
Yeah, it was fantastic. Like it was like the amount of messages I have. My time is up, so I couldn't read messages,
Oh no, fine, but we'll go through it again. I'm sorry, I was a bit I was a bit warming up in the beginning, but
yeah, it was perfect. It was perfect. It was perfect. Yeah. I will send you the